unceded territory of the Algonquin Anishinaabe people who have lived on this territory for millennia. Their culture and presence have nurtured and continue to nurture this land. We are grateful to have the opportunity to present on this territory. A few housekeeping items before we get started. You may notice that everyone was muted upon entry, just to make sure we keep the background noise to a minimum. We would ask that you put your questions in the chat, and when we get to the Q&A session at the end, you can also use the raise your hand function. This webinar is being recorded and we will post it on the Advanced Care Planning website. An email will be sent to everyone who registered so that they know when it is available and where to access it. So what can you expect for the next hour or so? We are going to review the key elements of the recently released Essential Conversations, a guide to advanced care planning in long-term care settings, why this was developed, how to use it, and some highlights of available resources to support advanced care planning in long-term care and a palliative approach to care. So before we get started, we would like to get to know you a little bit better. So I see we are at 38 participants. Amazing. And that number seems to keep moving. So if you wouldn't mind just taking a second to share where you're joining us from in the chat box, as well as answering our first poll. So what is your role in long-term care? If you don't see your role there, feel free to submit it in the chat, or if you don't feel that the words there reflect how you see yourself, I would say actually your primary role. We know a lot of you are wearing multiple hats. And also please do take a moment to introduce yourself in the chat, just so everybody gets to know a little bit more about who's in the room, the virtual room. So we'll just give it a few minutes while people are completing that poll. The chat is popular. Palliative care nurse consultant, palliative care nurse, social service worker, college student, nice. Hospice volunteer coordinator, longevity retirement planning, end of life doula, nurse clinician, advanced care planning. Wow, look at that. Digital media coordinator, welcome, very cool. Perfect. Well, it's always wonderful to see the diversity of roles that are involved in caring and bringing forward a palliative approach to care. RNs, awesome. All right, Michael, I don't know, are we going to share the poll results right away, or are we going to save that until the end?
We could do either. I could. Okay. I could show them right now if it's okay.
I guess we're going to save it until the end a little bit. Well, while all of that is being compiled, I do want to just share a little bit of information about the organizations that are involved in this presentation, and as well as the guide that you saw. So for those of you who may not be familiar, the Canadian Hospice Palliative Care Association, or CHPCA, is the national leader in the pursuit of quality hospice palliative care in Canada. And we accomplish this goal through public policy, education, knowledge translation, awareness, and collaboration. The Advanced Care Planning in Canada initiative is led by CHPCA with a financial contribution from Health Canada. The initiative aims to help people living in Canada prepare for their future health and personal care. And the project involves a series of public awareness campaigns, supports for community-based advanced care planning programs, as well as the development of various resources and guides like the one that we're going to talk about today. It is also supported by a national task group made up of advanced care planning leaders from across Canada, as well as special advisory committees. These individuals review and advise on the project at large, as well as the tools and guides developed as part of the project. Informed by clinical experience and through original research, a national team of health researchers developed Strengthening a Palliative Approach in Long-Term Care, or SPA-LTC, an approach to care that draws together best practices in palliative care within long-term care settings across the globe. These practices were tested in Canadian long-term care settings and adopted to fit local context. SPA LTC is a made in Canada approach. It's about making sure that people with life-limiting illnesses have more opportunities to experience a high quality of life from the moment they enter long-term care to the day of their death. These are the key contributors to the resource that we will be discussing here today. So the resource, if you haven't already downloaded the guide, it is available in English and in French at advancedcareplanning.ca. So when you land on the homepage, just scroll down a little bit to the latest news and you will see it there on the left side of the page. When you go to download the guide, you may notice a pop-up window. This is to help with our evaluation. It is completely optional, but it really does help us to adapt and continue to learn from one another. If you can share some feedback at a future time, once you've had a chance to get your handle on the guide and maybe started to think about how it can advise or guide some of the work that you're doing. There's an active chat window, that's great. All right, so jumping into this, before I pass it over to Sharon to walk us through the guide, I do want to take a little bit of time to talk about advanced care planning and a palliative approach to care to ensure that everyone's on the same page about where we're coming from. And then I will pass it over to Sharon to do a deep dive into the guide, what it is, why it was developed, and learning more about the resources to come. So advanced care planning, as you can see there, this is advanced care planning in Canada's working definition of advanced care planning. It's a lifelong process. It's about thinking and talking about the kind of care you would want if ever you were unable to speak for yourself. ACP Canada often talks about 5 steps to advanced care planning. These include thinking about what is most important to you, learning about your overall health, deciding on your substitute decision maker or makers, one or more people who are willing and able to speak for you if ever you can't speak for yourself, and talking about those wishes and values. And then recording them in some capacity, whether that's in a guide or whether that's on an audio recording or a poem, just making sure that it's captured some way and it's shared with your substitute decision makers, family, friends, loved ones, and healthcare providers. So that's where we're coming from. That process may also include lawyers or professionals helping you with your life care planning. Advanced care planning processes may differ slightly across Canada, but we feel that the value and importance of these essential conversations does not. And we work collaboratively with all the provinces and territories to try to bring awareness to advanced care planning. So I have been talking a lot. I am now going to turn it over to Sharon. Sharon's going to take us in through a closer look at a palliative approach to care and the guide itself. And as Sharon gets started, you may notice that Sharon is extremely passionate about this topic. So I may pop in from time to time to nudge her along to make sure that we have time for questions at the end. Sharon, over to you.
Thanks, Karen. I love that. That's a sign that we've been working together for a while. I completely appreciate your willingness to jump in.
We can't hear Sharon. Michael, can you check?
Oh. No, you can't hear me?
I can hear you, Sharon.
Okay, okay.
Oh, you can hear fine. Okay, it's just
Some
me.
people can. Oh, good. Thank goodness. Oh, technology isn't my favorite thing, so hopefully today it's on my side. But I was just saying thank you, Karen, for your willingness to step in. And you know me well, because I can go off and could probably talk about this for 3 hours today. But I think I have maybe 15, 20 minutes. So I'll do my best to stay within that window. So I'm as many of you know, have been working on a large team in Canada focused on strengthening a palliative approach in long-term care. And the term palliative approach to care is, you know, a newer term. I would say in the last 15 years, it's a term that's emerged because we're finding people who are at end of life, and at end of life, I mean, you know, two weeks to 3 months at the most, but they're coming to end of life not prepared, symptoms not managed very well, And families, particularly in long-term care, are having to make very difficult decisions without any preparation and support. And we're finding, families under these kinds of conditions are, often in crisis mode, is what we say. And, having a lot of guilt and burden that continues on into bereavement. So a palliative approach to care is one that's very fitting for long-term care. I'm sure many of you would agree with me. We should be thinking about a palliative approach as soon as residents are admitted or moved into long-term care. They're very frail, complex conditions, and we're seeing, residents living anywhere from a year to 18 months is the average length of stay. So we really need to be thinking about how we can support residents, how we can support families. So when a resident reaches end of life, the decisions aren't as stressful, and families are prepared to make those decisions. So a palliative approach, it's not just in long-term care. In fact, if we move to the next slide, Michael. There we go. Perfect. Thank you. So if we a palliative approach is a lot of work has been done, particularly with CHPCA, and some of you may be familiar with the Way Forward document, which really sets some standards across the country in terms of how we can think about a palliative approach, and how we can support people who have often non-cancer diagnoses, because those are the ones that are often referred to palliative care too late, and there's not a seamless transition from acute, active care to end-of-life care. So the Way Forward document, I think it's about 5 or 6 years old now, but it's really set the stage within Canada about how we can support a palliative approach across, lots of different life-limiting conditions, and particularly for those living in long-term care. So it's advanced care planning, as Karen nicely described, is a life planning process. So that you don't need to wait until you're in long-term care. In fact, you shouldn't wait until you're in long-term care. Advanced care planning should be happening early on. And in fact, I have conversations with my kids who are in their 20s about advanced care planning discussions. And ideally, hopefully in the next decade or so, people will be arriving into long-term care with having lots of advanced care planning discussions. And it won't be something we'll need to introduce for the first time while they're in long-term care. So that's the goal. Advanced care planning happens very early on, much earlier before people arrive to long-term care, hopefully. But unfortunately, in our world right now, long-term care, there are a lot of people who come into long-term care who haven't had any advanced care planning discussions. So we need to ramp things up very quickly. And because of this, we include a window of advanced care planning within a palliative approach in long-term care, because essentially we're trying to make up for lost time and lost discussions that didn't happen before they came into long-term care. And certainly, with 70% of residents having dementia coming into long-term care, we need to have those conversations with them while they still can, because we know as dementia progresses, residents lose their ability to engage in those conversations and have, very important discussions with their families and healthcare providers. So that's a big part of a palliative approach in long-term care, is to engage in those early conversations so that when we move later on into goals of care decisions and end-of-life discussions, their families and residents hopefully are more prepared and comfortable for those decisions. So thanks, Mike, for taking care of the slides for me. Advanced care planning, as I was saying, is a very important part of a palliative approach to care in long-term care homes. There is that little window at the beginning while residents are well enough to engage in advanced care planning that we need to take that opportunity and have those conversations. Ideally, we want to hear from residents what's important to them. So what kinds of music would they like to listen to, or do they like to listen to? What kinds of things are important to them in terms of spiritual support and that they envision that they would like to have when they approach end of life? How do they feel about pain? Some residents, when we ask them, tell us they want a little bit of pain. They can manage a little bit of pain, but they don't want it to impede their function or be very discomforting. So having those kinds of conversations while people can is very, very important. And it helps inform subsequent conversations and later on decisions at end of life that are critical. And we want ultimately is a seamless transition. So when someone enters long-term care to when they leave, not to have these times where we're scrambling to try to find the right people to have the right conversations. It should be happening in a seamless manner. So next slide, please. Great. So the guide, and certainly, it's evident in the guide, there is a little bit of tension around advanced care planning and palliative approach. And some people, prefer not to have those two terms together because they really mean different things for different populations. In long-term care, advanced care planning falls under the umbrella of a palliative approach to care, because the palliative approach, we're trying to change the culture in long-term care where we start, looking at a palliative approach at the time of admission. So that's how we've approached this guide, is to look at a palliative approach from the very moment someone enters long-term care to when they die. Advanced care planning at the beginning is a fundamental piece because, again, we want to engage residents in conversations while they can. And maybe we'll move on to the next slide, Michael. I'm not used to not being able to control my slides, so this is painful for me. So who is it for? The guide, we've developed it to help support long-term care homes. So long-term care homes can be the people working in the long-term care homes. It can be the ones providing the frontline care. It can be nurses. It can be administrators, regional health authorities, and policymakers. And we've engaged families and residents in most of the development of these tools and our model that we've published. So maybe next slide again, Michael. Great. So when should ACP happen? I've kind of already talked about that. So we want ACP to happen early on while residents are able to engage in conversations soon after they move into a long-term care home. There's lots of discussion. We've certainly heard lots of discussion from staff and families when they feel they would be most comfortable in having some of these discussions. And the challenge is, if these discussions and these conversations had happened before they came into long-term care, it wouldn't be so awkward to initiate these conversations. It should be easier. But what we're hearing is admission is a very stressful time, lots of things to cover. But for the most part, people are feeling like the 6 weeks post-conference is a great time to have some of these discussions while you have the whole health team, including the physician, available, and the families at the table as well, and residents. So really, as soon as you can is what we say. Advanced care planning should happen as soon as you can, because we don't want to miss that opportunity. So along with that, we've developed some tips, we've developed some tools and resources to try to help integrate advanced care planning within a palliative approach in long-term care. And along with that, we've certainly heard from staff, they're feeling they would like more support and more education about what is advanced care planning and what is a palliative approach, and how do I have those conversations with families and residents. So there is lots of training that already exists that we've incorporated into this guide as well. Next slide, please, Michael. Great, thanks. So this is kind of a visual diagram of our SPA LTC model. Some of you may have seen it. We've published a couple of papers on it, and it started off based on a scoping review. So we did a large scan of the literature. We worked closely with the Toronto Central LHIN. They were a part of this work as well, Rose Cook in particular. So we did a scoping review, looked at whatever we could around tools, resources, models. We put together this model a little differently in the first stages. And then we actually took this model to a bunch of stakeholders, people who work in long-term care, families, residents, to get their perspective about what do they think about this model. Does it capture what they think should be in it? Is there anything missing? And we use that feedback to adapt it, and this is where we ended up. Interestingly enough, when we went to the Residents' Council, originally this model was in that typical, you probably are quite familiar with it, the disease trajectory. There's one for organ failure, cancer, frailty. So the line starts at the top, and as residents decline, the line moves downward. So this stark decrease. But residents didn't like that. They said that was very depressing to them. They wanted this horizontal line. So that's why our model took this shape, because we certainly want residents to be comfortable with it as well, and we don't want it to be depressing, anything but depressing. And next slide, please, Michael. Great. So you would have seen on the previous slide, we have really kind of 4 time points. One is before a resident moves into long-term care. So there's lots of things that should be happening and lots of literature around how to best support residents and families with that transition moving into a long-term care home. And then once they're moved into long-term care and living in long-term care, generally, they can be well enough to have engage in conversations, not at end of life for the most part, although some do move into long-term care at end of life, but they tend to be well enough that they can, enjoy different things in life, engage in activities, and that's the time where it's important to have conversations, monitor, look at any kind of change or decline, and build relationships and have these important conversations. And then there's always a time point, and it's interesting having conversations with different long-term care staff. It's often the personal support workers or the care aides that are the first ones to notice, significant resident decline. And they'll often say, "Oh, I'm noticing, so-and-so isn't eating as well. I'm a little worried. Are they, kind of getting closer to death?" But we need to listen to PSWs because they do have that, intuition in that sense. So at that point, generally, care would focus more on, comfort care, goals of care conversations. So, looking at current treatment as opposed to ACP, which is about future care. Now residents are at a point where they've declined and they need different kinds of treatment at end of life. So there is that transition point. And often what I hear, staff saying is when are they palliative? Like, it's that label, when are they palliative? We're trying to avoid that label. It's hard because there is that, point where people notice they're getting closer to life. But we want to move more to the front end and help prepare people so that transition is a little bit smoother towards end of life. And certainly the last stage, after a resident dies, we're seeing more and more, the issues that come from grief and bereavement, and families and staff and residents not being supported in this stage, and it has lasting effects on them personally and with the care they provide for other residents. So this is something I think we really need to focus on, and certainly, there's lots of really good work happening. Canadian Virtual Hospice have this as a priority, which we traditionally have not done very well. All right, next slide, please, Michael. Great. So going back to the model, generally, soon after a resident moves into long-term care, it would be great if they've already got their substitute decision maker decided upon, and ideally they would have, but unfortunately that often isn't the case. So that's one of the first things that falls under advanced care planning. Hopefully the resident is still able to be a part of that, that discussion, is to help confirm the resident's substitute decision maker for later on down the road when the resident is no longer able to make decisions for themselves. We want them to have the choice to choose someone that they want to be the one to make those decisions. So very important step. And something that generally happens very early on, if not before they come into long-term care. And making sure that the resident has opportunities to talk about their values and wishes and preferences for care with their substitute decision maker as well as the staff. How can we bring those conversations to the forefront? Document some of their preferences and values in the chart so others know about them. And some of them, some of their values and wishes, we don't have to wait until end of life. There are things that could be happening now. If they want to listen to a certain kind of music, let's get that music available for them while they're still able to enjoy it. Because it's about quality of living and quality of dying in long-term care. And certainly communication barriers are a challenge with lots of different languages. More and more, we're moving beyond just French and English in Canada now. We're seeing, lots of different languages, as well as, limitations with advanced dementia and residents' ability to communicate with others. All right, next slide, please. There we go. And equity, diversity, and inclusion. It's certainly, we're seeing, again, Canada is becoming a very diverse population. And sometimes with that, we're not prepared or have tools or processes available to help support diverse populations to engage in ACP and a palliative approach to care. So one of our homes that we've worked with before is a downtown home, we call it, and 80% of the residents were homeless before they entered long-term care. So they don't have any families that we can include in family care conferences. Essentially, their substitute decision maker is the public guardian trustee. So how do we engage the PGT to have conversations with the residents early on so that the PGT can act in the best interests in what the resident wants at end of life? So there's lots of caveats. Some of our tools we've been trialing in LGBT populations, homes that have large LGBT groups, different cultural groups, which we want our tools and our model to be inclusive of all Canadians. And the importance I've mentioned of revisiting ACP conversations early on. So at the very least in long-term care at our annual care conferences, while residents are well enough to participate in those conversations, it's a great opportunity to talk about what's important for residents and to share, for residents to share their wishes with others, including the healthcare team. Yeah, and I think I've talked about the last two already, Michael, so we could probably move to the next slide. Great. And of course, with anything new or new tools, training and supporting the long-term care team is critical. We've, certainly seen the interest and the need for staff to be more comfortable with implementing a palliative approach and advanced care planning. A couple of my graduate students have done interviews and looked at long-term care staff's perceptions about advanced care planning. And what we found quickly early on is they don't really understand what advanced care planning is. So for them, advanced care planning is, checking off, a CPR designation or no CPR. Planning funerals is another common one that people think about for advanced care planning. So there's lots of a huge need to educate long-term care staff and get them comfortable with having these very important conversations with families and residents. So there's some training, lots of training happening with the LEAP long-term care curriculum. HPCO and CHPCA are developing some PSW competencies for around a palliative approach. So there's lots of really, really good work happening. And we do have good programs. The challenge is the cost. We all know the cost of these programs is a huge challenge, and pulling staff off of the unit and supporting them to attend these education programs is a huge barrier. So one of our team's goals is to find ways to integrate more education and training, whether it be through resources outside of the long-term care. So in the case of Ontario, we have palliative consultants. So having them come in to do huddles with the staff, to do some on-the-spot reflection and training. I have no doubt there is a huge need for formal education, such as LEAP long-term care and some of the other programs. But it is costly, and it's hard to get all staff trained and educated, which is what needs to happen. So we do have some tools and supports to help with training and educating and supporting long-term care staff to implement a palliative approach. All right, and I think I might be coming to the end of my time, and Karen hasn't even interrupted me yet. Wow.
You were brilliant. You were perfect. Thank you so much, Sharon. And I apologize for the little mute issue. I had muted my computer so that I wouldn't get distracted. And apparently I muted everything. So thanks everyone for letting us know that you could hear Sharon just fine. So as Sharon mentioned, there's lots of tools within the guide itself, but I did want to highlight a few initiatives that are underway right now in terms of additional tools for long-term care resources. Sharon did mention some learning for personal support workers. So it's not here, but Sharon mentioned it. So perfect reminder that CHPCA, in collaboration with Life and Death Matters and Hospice Palliative Care Ontario, are creating a national online learning program on palliative care for personal support workers. So I believe information was shared about that at the HPCO provincial conference, and the CHPC conference also coming up in October will likely have more information, but all things that are under development. Also, in addition to the guide that we are featuring here today, in March, it was in March of this year, CHPCA and SPA LTC launched the Palliative Approach in Long-Term Care Community of Practice. And this is a group of professionals, patients, caregivers, and other interested individuals who come together on a monthly basis and we share our experiences and best practices regarding advanced care planning and palliative approaches in long-term care education, implementation. This includes challenges, successes. We're really forming the group based on feedback. So we recently completed a survey of the membership, which went from about 12 people in March to 90 people as of our last meeting. So a lot of great feedback to help to inform the direction of this group and make sure that we are responding to the needs of members. Sometimes we have guest speakers, sometimes we have different discussions. The meetings do take place every second Thursday of the month. So if anyone is interested in learning more or signing up, the next meeting is on July 8th, I believe. And you can learn more at the URL that's listed there. We are also working with Pallium and the long-term care, the Canadian Association of Long-Term Care and several other organizations to help to streamline and coordinate our efforts for various networks and communities of practice, just to make sure that we are connecting ourselves, keeping ourselves informed, not duplicating effort, and making it as clear as possible kind of where to go for what information and to help that information flow back and forth. So that's also something that is happening in the background. Recently, actually, at the Community of Practice, there was a presentation of the Canadian COVID-19 long-term care environmental scan, some of the preliminary findings. So this was a scan undertaken by SPY LTC to help inform all of our respective efforts. The report will be out in the coming months, but really what it did was examine the current Canadian long-term care practice as it pertains to a palliative approach to care, including advanced care planning and goals of care in the environment of COVID-19. It looked at where people are most likely to find resources, as well as the best way to disseminate resources to family and staff. So look for that coming soon. And that's also part of what we're learning and exploring in our community of practice and in those consultations with other organizations and individuals across Canada. Probably one of the preliminary findings was the importance of not duplicating effort, and that a lot of new resources were developed during COVID-19. And so it's more maybe about identifying what's currently available, adapting something maybe instead of starting from scratch. So really it's around both what already exists as well as what's under development. So those already are learnings that we've had from the scan and from discussions across the community of practice. And so that is informing a curated repository of long-term care focused resources. So these would be pulled both from the guide that features a few resources in there and the long-term care environmental scan as a starting point. We are in the process of identifying some criteria to make sure that there's a bit of rigor in what is being posted. And also if something is not posted, so that we are very transparent in what we're providing and why, and what the decision was in order to post it. So those are things that are coming soon. Just before I open it up to questions, in this, from this perspective, I think we have another poll. Michael, am I correct? In terms of a chance to learn about what we can learn from each other and how you prefer to receive your information. I think we have one poll about how you prefer to receive. We have a pain points poll and another question. So this one is just to better understand, as we're collecting information, as we're assessing resources, as we're looking at speakers and communicating around learning and stakeholder engagement and gaps and information and knowledge to share. We're also curious about what are your pain points now? So, we do research and it's based on different points in time. So we wanted to just take a second to pause and get your thoughts on what your pain points are. If your pain points are not listed there, if this is completely off the mark, again, feel free to put them in the chat. This is just helpful for us to understand the reality of your particular context and how you may be feeling. So I'll just pause to give people a chance to complete the poll. While people are doing that, if you do want to stay up to date with any of these developments, you can certainly follow Advanced Care Planning on our social media channels. So we're on Twitter, Facebook, Instagram, LinkedIn, I don't think I've missed any, Michael. And then we have a monthly newsletter as well that you could subscribe to. I'll try to put something in the chat there in order to kind of easily access that. So we try not to overwhelm folks with information, but we want to make sure that you have access to it if you would like it. Perfect. So Michael, did you want to, or are we able to share the results of that poll? Aha. So it looks like lack of resources and staff shortages are one of the major pain points. Public perception, very interesting. I think that's a particular interest around just thinking about the work that CHPCA does around awareness and campaigns, and maybe there's a role there. Fatigue and burnout. Ooh, yeah. Wonderful. And we'll look for some of the other, if you're not comfortable sharing them in the chat, because I know your name is there, that's no problem at all. But I guess I would just put an open call to say that the community of practice, we're always looking for feedback on things to discuss. But there's lots of different opportunities to provide some input and feedback. So please don't be shy. Perfect. Thank you, Michael. And then just the last poll before we get to the Q&A is around how you prefer to receive information. So this was something that was also teased out in the environmental scan. Perfect. Thank you. I'll chatterbox a little bit while folks fill out the poll. Just about what is the best way to get information into long-term care homes, whether that be for patients or their family, health professionals, management. Where are they going? Where are you currently going to gather your information? Some individuals who were interviewed for the scan indicated that at some points it was overwhelming. There was almost too much coming at them from a whole bunch of different places. You know, so what does those go to? Everything transitioned online. So all of a sudden too, everything was different, as we all know. So just looking to make sure that we are not bombarding, but are connecting and sharing and focusing on those things that matter most to you. Perfect. So we'll give you a chance to finish that. And then whenever you want, I think, Michael, you can see how many responses come in. So whenever you feel ready to share, we can share those results. Webinars, look at that. Well, that's good. I feel like we have a bit of a biased group because I'm asking the question on the webinar. So that's great. That's good to know. One of the learnings I've had actually recently through these different conversations around webinars and timing for meetings and communities of practice and networks. And it's something as a national organization we're always very conscious of, but have not necessarily found a great solution to, is the time of these webinars, when to host them. And we often stick to a particular window or a set time. And so just like the community of practice I was talking about, every second Thursday at, I think I said 11 a.m. I can't remember if it was 11 a.m. or 1 p.m. But maybe that doesn't work for certain time zones. And maybe that is right before a shift change. That came up recently, actually around the timing of this webinar. So that's something that we're looking at. Also making sure we offer recordings. Recordings are not always the same because you can't ask your question, but thank you. E-newsletters, so that's also very helpful for us to know. So thank you for taking the time to share that information. Oh, it's all good. And with that, I will pause and turn it over to questions. So if you do have a question, I didn't see anything. Oh, would you please repeat where the toolkit is located? Yes, absolutely. So advancedcareplanning.ca, and we can put, actually right there, you can see the URL for the community of practice. If you just go to the home page and then you scroll to news, so just scroll down, you'll see news, and it's right there. You can also use the search feature on the website, and it's a pretty good search feature, but advancedcareplanning.ca is where you can access the toolkit. For who attends the community of practice meetings, it is diverse. So we have a sign-up form to help us understand who has joined. It is a mixture of folks from across Canada. So it's right now, there are quite a few people from Alberta and Ontario. There are a handful of folks from Manitoba and Saskatchewan, and then BC and some scattering. So that's also, I think, that just the snowballing of awareness, it's still fairly new. So there's a bit of geographic diversity. And it's a mix of, I'd say there's about, of the 90 members, based on the list I looked at last, there's about 25 that I would identify as have a clinical role in some way. I think there was about 13 who had identified as educators, having an education role, whether that is in a faculty of nursing or within the professional setting. So often there was multiple roles. So we're actually going to probably be revising our form a little bit so we can tease out a little bit more detail from the membership without having to survey them all the time. There's also researchers are part of that group, a small number of caregivers and family members as well. So right now that seems to be the makeup of the group. Sharon, am I missing an element that of the community of practice that has stood out to you?
Nope. No, that's perfect, Karen. Yeah.
Wonderful. So I don't know if folks raise their hand. I think you'll move to the begin. I don't know what happens when you raise your hand. That's why I'm so glad Michael's here. Did anyone have any questions about the guide or any of the elements that Sharon talked about?
Yeah, there's a question in the chat about the community of practice, Karen, and just to kind of reiterate that essentially, we're trying to be more inclusive than exclusive. So anyone really who has a passion and interest in promoting a palliative approach in long-term care, you're welcome to join. So even if you don't work necessarily in long-term care, but there's some members who are working in the community, but want to see how they can help support the long-term care sector. Where they're included in our community of practice. We have a couple family members as well who have added a lot of richness to our discussion and perspective. And for now, that's kind of our philosophy in terms of. So far, we haven't said anyone can't join. I think, Karen.
That is correct. And we do have a terms of reference. So if anyone is interested, we can absolutely send those to you. I will put my email actually in the chat so that it's very easy to reach out. Actually, Michael, did you want to share the poll results from the beginning so we can get a sense of who's actually some of the role? Oh, there we go. Healthcare practitioners, welcome. Perfect. Well, welcome everyone. Sorry, I guess I was blown, but it was the strongest of any of the polls that we had. Perfect, thank you very much. I cannot do two things at once, so I will type my email in. There we go. So feel free to reach out at any time.
Yeah, I would love to get, some more practitioners in our community of practice. And, there's no obligation. I mean, generally, Karen and Caitlin is our supportive person, put an agenda together. We, talk about it at the previous meeting. And you don't have to come to all the sessions. You can come to, once in a while. But it's nice even to sign up just to be in the communication loop, because we are finding now we're trying to share information through the community of practices as we all hear about it.
Yeah, I should also mention one of the things we're exploring is how to connect members between meetings. So this was part of the survey we recently completed around kind of topics of interest, frequency of meetings, recordings. We didn't want to really assume anything. But this idea of using a shared platform to help members connect without, CHPCA or without us being a bottleneck was something that was actually quite supported. So we're exploring that right now, which I think will be interesting. So even if, the webinars or the meetings themselves, maybe you can't make all of them, you'll still be able to connect with members through this platform. When I say this platform, I don't know what it is yet. We asked about LinkedIn, Facebook, Teams. There was not, to be honest, there was not a strong preference for any platform, but we're going to give it a try and we're going to learn as we go. But that's something that we're also exploring.
And just to build on what Karen was mentioning earlier in terms of our environmental scan, and what we started to do with this guide, so we had an advisory board, a national advisory board that helped inform the guide, and we tried to gather, as many tools and practices that we could get our hands on, largely through the advisory board, to provide links to in the guide, because essentially that's what we wanted was, we were hearing from people, they wanted to know when to use what tool at what point in time. So essentially we've tried to, gather tools and then, kind of slot them into one of those 4 stages when we felt it would be most appropriate. So we've done that in the guide, and we've also done some additional work with the scan, which Karen mentioned, and went a bit broader. We've covered all the provinces and tried to get as big of a sweep, I guess, of what tools and resources are out there. So that's now going to be posted on the CHPC website. Is kind of this repository of tools. But I always invite, we're never done. I find as soon as, we think we've got a good stash of tools and good representation, I always learn about something else. So this is kind of one of our main goals, I think, is to get this network. So there is more sharing of tools, and we're more familiar with what's happening across the country. So we don't have, 5 different groups developing the same tool, but how can we build on one another's work and work together to kind of move this all forward? So if any of you have any tools that aren't in the guide, we haven't posted the ones from the scan yet. It's just hot off the press. But I would welcome you to, reach out to Karen. She's got her email address there, to share any tools or resources that you think would be helpful for others to know about, because that's one of our goals, is to develop this repository and really see what great work is happening across the country.
Thanks, Sharon. Well, I think with that, unless there are no questions, I don't tend to extend meetings just to extend meetings. So I will pause and just see if there's any other final questions to come in, but please don't hesitate. Sometimes I know myself, you need to process some of the information. You might want to go through the guide a little bit more, and once you've seen it, you'll have questions. So feel free to reach out to me. I will absolutely be able to connect you with Sharon if I can't answer the question, or one of the members of her team. But we are here to learn, we are here to share, and we appreciate you taking the time to join us here today. And yeah, enjoy the rest of your day, however short or long that might be. And thank you so much for taking the time to join us today. And thank you, Sharon, and thank you, Michael, for the presentation, the knowledge, the technology, and the support. This is always, as usual, a team effort.